Up to 2,000 COVID cases a day just in Sydney's hotspots. That's the prediction made by official modelling revealed by the Premier. And hundreds of people could end up in intensive care by late October. But Gladys Berejiklian insists the health system will cope. Here's state political reporter Ashley Raper.
The hospital system has been under increasing pressure. So too has the Premier to reveal just how bad it's predicted to get.
Whilst things are stretched now, we appreciate they're going to have additional pressure put on the system in the next few weeks.
Modelling released today only relates to the 12 local government areas of concern, and cases there are forecast to peak at up to 2,000 new infections a day sometime next week. That will result in up to 3,900 people in hospital a day in the following weeks.
What this model does is give people a medium and long-term look at what the next few months will be like.
560 COVID patients are estimated to be in ICU at the end of October and early November. And adding non-COVID patients, that number is likely to rise to almost 950. So the government is planning for the system to be overwhelmed. That means higher staff-to-patient ratios, and critically ill patients may be transferred to other hospitals.
We'll be able to manage that. Have we needed to explore not only different physical areas, but different ways to support the staff to manage the patients? We absolutely have, because we've watched it occur overseas.
There are currently more than 1,000 people in hospital, 177 in ICU. Cases are down slightly and there were 6 more deaths. An Aboriginal woman in her 70s has died in Dubbo. She was from the remote town of Angonia. It's the second Indigenous death. What wasn't revealed today is how many deaths are expected. This modelling is also based on the situation at the end of last month and reflects the vaccination rates at that time as well as the lockdown restrictions. So the government is quick to point out these numbers could very well change.
We have seen the scary trajectory and been reassured about the hard work that our intensive care and our staff are doing to prepare for this. But we can change that trajectory.
Dr Chan points to increasing vaccination rates and ongoing restrictions, while the Deputy Premier insists one rule isn't working.
If you look at the numbers since we put the curfew in, nothing's occurred, nothing's changed, numbers continue to rise. Let's be honest, guys. I mean, the reality that we went down the curfew model for southwest and western New South Wales is because in one way there was a lot of media push.
The government is pushing ahead with ensuring people can prove they've been vaccinated. It's revealed how a person's status will be displayed on the Service New South Wales app. Ashley Raper, ABC News, Sydney.
And Ashley's still with us. Ashley, the Premier says the predictions change all the time, so how useful is this modelling?
Juanita, there are now some numbers to attach to the Premier's comments about cases peaking and hospitalisations rising. So it gives an insight into the figures the government is using to inform its decisions. But there are a lot of variables. Gladys Berejiklian was at first reluctant to release modelling because she says it changes all the time. But she released it after continuing calls to do so. So in the end, it was also about the Premier being seen to be transparent. But we know that this modelling doesn't reveal the whole picture. Part of it focused solely on the hotspots, and the ABC understands more extensive modelling has also been done. So, Juanita, what we have now and what's been released to the public is a selection of the modelling that's been provided to the government.
Ashley Raper reporting there. The state's west and far west continue to have the biggest increases in COVID cases. Bill Ormond is live in Wilcannia for us. Bill, the town is on the verge of a terrible milestone.
That's right, Juanita. 99 cases have been recorded in Wilcannia tonight. And of course, that's 1/5 of the town's population. So that's roughly, including today's numbers, that's 7 new cases in the far west, 1 of those in Wilcannia and 6 in Broken Hill. Now, Dubbo has also recorded 35 cases, including 6 in Burke, 2 in Orange and 1 in Narromine. The state's south is also seeing an increase in Queanbeyan, Goulburn, Cooma and Batemans Bay, and concerns growing around the Illawarra Shoalhaven after 21 new infections. The Hunter New England saw 5 new cases and 8 in the Central Coast. Now, we're outside Tent City here tonight. We're around 20 healthcare volunteers working constantly, and will sort of be staying for the next few weeks at least. Now, not too far from here, there'll also be another camp as well for people with COVID. So that'll include around 30 motorhomes, which have been sort of filtering through the town over the past few days, rather. And so those will be for COVID patients and those isolating nearby. So residents really have been crying out for this, and until now, many have been living in overcrowded and cramped situations.
At the moment, it's important that we've got somewhere for people to isolate, and that's an ideal spot. It's a good setup now with the vans there and with the amenities they put in place. I think people will be comfortable for 14 days there, so and well looked after.
So while the extra resources are much needed and they're very thankful for, the crisis is still far from over.
Bill Ormond talking to us there from Wilcannia.